How has our understanding of trichomoniasis evolved? Imagine a disease that has quietly affected millions for centuries, yet only in recent decades have we begun to truly understand it. That's the story of trichomoniasis. It was first identified in 1836 by a scientist named Alfred François Dunn, who observed tiny, moving organisms in vaginal and cervical secretions under a microscope. He named these protozoa Trichomonas vaginalis, laying the groundwork for recognizing it as a distinct infection. But it took about 80 years before the medical community officially acknowledged trichomoniasis as a separate disease in 1916. Early on, doctors mainly noticed symptoms in women, like vaginal discharge and itching. Some women even showed a characteristic strawberry cervix, a red, bumpy appearance of the cervix. However, most people infected with trichomoniasis actually show no symptoms at all. Studies now show about 85% of women and 77% of men with the infection are asymptomatic, which made detection and control tricky. The way we diagnose trichomoniasis has come a long way. At first, doctors relied on wet mount microscopy, where a sample is examined immediately under a microscope. But this method isn't very sensitive, meaning it can miss infections. Later, culture techniques using special media became the gold standard, allowing for more accurate detection. Today, molecular tests like nucleic acid amplification tests are available. These are highly sensitive and can even be used with self-collected samples, making screening easier and more accessible, especially in places where pelvic exams are difficult. Epidemiology has also played a role in shaping our understanding. Trichomoniasis is now known as the most common non-viral sexually transmitted infection worldwide. Each year, around 156 million new cases are reported among people aged 15 to 49. It tends to affect women of reproductive age more, especially those with multiple partners or other sexually transmitted infections. In some groups, infection rates are higher than for chlamydia and gonorrhea combined, highlighting its widespread impact. On the biological front, scientists learned that Trichomonas vaginalis is a motile protozoan with flagella, which helps it move through the urogenital tract. It releases proteins that damage epithelial cells lining the vagina and urethra, leading to symptoms and raising vaginal pH. This damage not only causes discomfort but also makes it easier for other infections, including HIV, to take hold. Studies have shown that having trichomoniasis increases the risk of acquiring or transmitting HIV, making it a public health concern. Treatment options have also advanced. We now know that antibiotics like metronidazole and tinidazole are effective in curing most infections when taken correctly. It's important to treat sexual partners at the same time to prevent reinfection. Patients are advised to avoid alcohol during treatment because it can cause unpleasant side effects. Healthcare providers also emphasize the importance of abstaining from sex until treatment is complete and symptoms resolve. Public health efforts have recognized trichomoniasis as more than just a nuisance. It's linked to serious reproductive health issues, including pelvic inflammatory disease, pregnancy complications, and preterm birth. Preventive strategies like consistent condom use and routine screening in high-risk populations are now recommended to help reduce its spread. In summary, our understanding of trichomoniasis has grown from simple microscopic observation to a comprehensive picture that includes its biology, how it spreads, how it affects health, and how best to diagnose and treat it. This evolution reflects ongoing scientific research and public health efforts aimed at controlling and preventing this common infection. If you think you might be at risk or have symptoms, always consult a healthcare professional for personalized advice and testing.